Hello, good morning again. So we're going to do the continuation of the first part of the head to toe assessment. So what I'm going to do now after sanitizing my hands is to just assess the lung field. So we'll go behind you.
Okay.
So I would lift the shirt up and see if the skin looks fine, skin integrity is fine, there's no rashes, no abrasions, and color appears to be fine. Just gonna go around, palpate there. Take a deep breath. Okay. And then still in this angle, which would be like the costovertebral angle, if there's any pain associated there, that could be indication of like kidney inflammation or kidney disease. I'm gonna go ahead and auscultate. So using the diaphragm. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. And then off to the side. Breathe in. Breathe in again. Okay. And then, so sitting right here, I'm just gonna test for fremitus. So I'm gonna be in between the shoulder blades, and I just need you to say 99.
99. 99. 99.
Okay, so there was no sounds of fremitus. Now I'm gonna do the percussion. Okay, sounds about fine. Doesn't seem like to be any abnormalities there. And I'm gonna do the same thing in the front. So I'm just gonna palpate as well. Everything feels fine. Doesn't feel to be any masses, no lumps or anything. There's no tenderness either. Gonna go again. Just the diaphragm. Just check the different points. Breathe in. Okay. And so that concludes the first part of like the for the lungs. There was no rales, there was no wheezing. It appears to be fine. Now I'm going to move on to the upper extremity. So
I have to get up.
no. So you're still going to be sitting down. We're just testing like the different components of your arm. So looking at your skin, if you could bring out your hand, the skin looks fine. There's side pressed down. There's capillary refill in less than 3 seconds. Skin is warm. There's no cuts or abrasions. Are you able to lift your arm up? Okay, can you do the same with the other arm? Okay, can you bring your hands like this? Bring them up here, bring them up, move them around, then put them down your back. So that's getting all the flexion, internal rotation of your arm. And, sorry about that, you might need that. And now we're gonna do that against a little bit of resistance. So if you have your hands out like this, bring them in towards you, like, yep, okay, flip them down, try to lift them up, then flip your wrist, try to bring them back to you, bring your hands like this, don't let me squeeze, okay, have them open, don't let me bring them down, bring your arm straight up, don't let me bring it up, okay, now push down on my arm, okay, we'll do the same thing on this arm, pushing down, and then pushing up, okay. So as far as the upper extremity goes, you have about a 4+ to 5+ with going against maximal resistance, and the integrity of the muscles look fine, skin texture looks fine. And now we're gonna assess your heart. So We're gonna go back to if you come in a little bit forward, just to 30 degrees. Okay, so what I'm gonna do now is find the different points. So I'm gonna do the actual oscillation for it. So finding the sternal notch and then going there from you a little bit to your right. We are using the diaphragm going back on the second intercostal space. We're doing the aortic, then going right across. We are going to the pulmonic, then down to the fourth. We're going to the tricuspid, and then down to the fifth. We are going right there by the apical. I'm going to do the same thing, but now I'm just going to do it with the bell of it. And the fifth point is the intercostal space between the fifth going in line of the midclavicular line. And now I would have you lay back fully, but just in this case I won't. But if I did, that's how I would test for the S3 and S4 to kind of tell if there's a gallop. And then in that point, I would also look at your back to see if there's anything, the skin integrity of the back and the sacral region, to see if there's any scrapes, abrasions, lumps, or anything associated that could be not in line with the skin integrity being fine. And then now, the next portion, we will be doing a neurological test. So on this portion, I'll be using a few tools just to kind of test a little bit of like proprioception, sensations, and different neuro-related aspects. So eventually use a reflex hammer, but for right now we're going to use the tip of the reflex hammer, and this is just going to be sharp. Mm-hmm. And then this will be the soft. I'm gonna be pointing at different parts of your body just to kind of get a feel for you to see if there's any parts that are not as responsive as others. So I'm gonna do this while you are doing this with your eyes closed. And then you just tell me the area that you're feeling it and then what it is. So if I did this, this would be
my right cheek.
And it's sharp or soft?
Soft.
Okay.
Sharp left. Soft right. Sharp right. Soft left. Soft leg. Sharp knee. Left. Right knee hard.
Okay, and then this would be also on the skin for your legs too, so that's probably why it's a little bit more difficult to do that, but that's one of the things. The next thing would be just testing to see kind of a cognitive level of what you think something is. So I'm just gonna have your eyes closed, and I'm gonna give you something on your hand, and you tell me what you think this is.
Cellular.
Yes, cellular. Yes, of course. Okay. Then another thing that we're going to test is your proprioception in space. And so that's looking like is I'm kind of just having an appendage or something of your motion that will go up in space. So for example, your hands are like this and I go like that. that's pointing up.
Yeah.
And then this would be pointing down, out to the side would be inside, and this will be outside.
Yeah.
All right, so I'm gonna do that with your eyes closed. You ready?
Okay. Point up, pointing right, left, pointing down, pointing right, pointing up,
Okay, I'm gonna do the same thing with this hand.
pointing up, pointing right, pointing left, pointing down.
Okay. Now, you're gonna have your hand out. This is for graphesthesia. I'm gonna just basically write something on your hand, and you just tell me, I'll write a number, and you just tell me what number it is.
On close side?
Yeah,
Okay.
I'll do it standing this way, so it's like you're writing it. Ready?
Mm-hmm. 7.
Yes. Okay. Now, another portion of this is there's a 2-point discriminant test, but I don't have 2 pointers, and that basically is your ability to distinguish where there's 2 points that are touching on your skin, and whether it's 4 or 5 millimeters apart. So the further it goes, and like how far you can detect when something is how close they are. So if it was like 2 pointers that are that close, or 2 pointers that are further away. So it's like indiscriminate point test. But we'll skip that for now. What I will do is now we'll use the reflex hammer, and with the reflex hammer, I don't know if you had any caffeine? Have you had any?
Yes.
Okay.
Love coffee.
So it may alter a little bit of it, but should get most of the stuff. So if you have your arm out, so again we'll assess the skin, and because I missed it the first time, going up here, this would be the radial pulse, and it's bounding, so it's strong, it's not weak. Underneath on this side would be the ulnar side, so the ulnar pulse, and you get your arm a little bit up here, right by the antecubital fossa, going up about an inch. It would get the brachial artery. And so from right here, just gonna tap you. Okay, so there's like a slight movement, but not that much. We're gonna do this right here too, to see if this elicits anything. So move a little bit. I'm gonna grab your shoulder, just bend it out here. Not sure if I'm gonna be able to fully grab this. So I'm just gonna come there and you just relax. It's a slight movement, not that much, but that could also be my error.
I may have issues.
No, you're right. It's probably me. The next thing would be, I would do one by your knees. So like a patellar reflex test. And this is testing the integrity of the, how fast and how connected it is to when, if it hits your kneecap, and a normal response would be if I hit this, and then you would have a movement of extending your knee. So, the next thing, or the other portion, would be the lower extremity muscular test. What I will do, since we did the shoulder and everything there, now what we're gonna do is basically test up. So can you bring your leg up? Okay, bring it back down. Bring this knee up, and bring it back down. Does that feel okay?
Yeah.
Okay. So that's basically getting a little bit of your hip flexors and getting a little bit of the quad muscle. I'm gonna have you do that again. Just gonna place a little bit of resistance on that. Does that feel okay?
Mm-hmm.
All right, I'm gonna put more resistance on it. Okay, so you have a 5 there, the same thing there. We have 3. I'm gonna stabilize you more so you don't cheat as much. Go up again, okay, still a 5. And then if you were in a higher position, I can get you to kind of shift out, and then to test kind of the external rotating muscles and the internal rotating hip muscles. Further, I'd go down to, or if this was higher too, to have you kind of kick out. Okay. And then that's getting your quad muscle. And then if you bring that in, try to bring your foot in. Like bring this foot in. Yeah. Like you're trying to like bring it back to the couch.
Oh.
I know that like we're limited by the space, but yeah, so then that would also get like your hamstring and your quad and go down further to assess your foot. And on your foot, would be able to test a little your dorsiflexors, your plantar flexors, a little bit of the calf integrity as well. Furthermore, if like you didn't have the socks on, you could see the capillary break fill on the toes as well. See the skin and the texture. If there's any scrapes, abrasion, any like venous insufficiency or any swelling, any edema that could be present. Then also would look to see or palpate for the different arteries that would be around there. So if I started from like your hip, there's a femoral artery, and then behind your knee is the popliteal. Then we would look for the dorsal pedalis artery on your foot, and then the lateral one by your ankle. There would be another test that I would have you do, testing your abdomen, which first I would have to hear first. So, but in this position, I'm not exactly sure how it would work, but I would listen to it first, because if I do any percussion on it or palpate, there's bowel movements and it might misscrew the results. So firstly, I would hear to see if there's any resonance or any sounds across the abdomen, and then to see if there's sounds, then that's good. That means that like there's like activity working. I would also hear in between the xiphoid process and the umbilicus. I would put it there to kind of hear the aortic brutus. The aortic brutes. Then going on my right would be your left renal artery bruits, and then same thing going right here would be your right renal artery bruits, and then going back down further would be assessing the iliac artery, your right iliac artery, left iliac artery, and then kind of going right where the femoral artery was, would hear if there's the rhythm and rate for it. And then lastly, I will have you stand up.
Okay.
So in this, do you feel okay?
Yes.
Okay, able to sit back down? Okay, so we'll stand back up one more time. And what we're gonna do is, so we're just gonna walk across the length of the couch. And with this, just walk normally. Okay, and then you can walk right back. And now walk one foot in front of the other, like heel toe in a line. And then you would come back. Whoa. Okay.
Bad balance.
No, it's good. It's good. You taught yourself, and like at least you're cognitive that you know that there's also some missteps when you're going. But it looked fine. There's maybe a little bit swaying, but there's no like ataxic gait. It doesn't look like it's related to any neurological issues, so it looks fine. We're gonna do one more where you're going to be we'll do a few more, but you're gonna do it on your tippy toes now.
Okay. Straight.
Yes, straight line. You're just gonna go on your tippy toes. And then you're coming back. We're gonna do one with your heel. This is the last one I'm making you do. We're just walking on your heel, yeah. Does that feel okay? You can have a seat.
Okay.
Wanna let you rest for a little bit. We'll do like 2 more things standing up, and then there's gonna be one more neurological assessment that I kind of skipped over, but we'll do that in a second.
Okay.
Yeah. Are you okay?
Yes.
Okay, so if you stand back up one more time, and then what I'm gonna have you do is, if you could try to bend over to touch your toes. Okay, does that feel okay?
Mm-hmm.
All right, you have great flexibility coming back. So if you come back up, and then just assessing, well, if you had another garment or like plain clothing, it'd be able to assess the vertebrae. And if you do that one more time, kind of see if there's anything sticking out, any of the vertebrae, if there's any scoliosis or anything that appears to be out of line. And then if you bend to your right, all right, and then you bend to your left, does that feel okay?
Yes.
All right, I'm gonna have you do the same thing. I'm just gonna place a little bit of resistance. So go to your right. Does that feel okay?
Mm-hmm.
Then go back to your left. Okay. So your gait looks normal. Very conscious of what you're doing and how you're stepping. The back of your vertebra looks really good in your movement. There's no swaying. You're not moving forward in that motion. So if you have a seat, that's the end of that musculoskeletal part. A part that I did miss for the neurological exam. So what you're gonna do is, you're gonna tap my finger, and then you're gonna tap your nose. So,
Here.
yes, and you tap my finger, and tap your nose. And do this 4 times. It's 2, 3, 4. Now you're gonna do that with your left. Okay, and then if we were higher up, I would have you, because that's testing like your upper appendages, going down to your lower, and have you go up with your right and then down on the shin with your left, and then same thing. But we'll forego that for now. But just as a reference, if we were on an actual medical table, I'd have you do that as well. And another thing would be, I would have gone back to the apical site and used the bell to hear it for about 1 minute. But other than that, everything appeared to be fine, and that concludes the second half of the head to toe assessment.
Okay.
Thank you.
Thank you.